Hey everybody, Dr. Michael here with Valiant Physical Therapy here in Evanston, Illinois, where I specialize in working with runners. I just started working with a new patient yesterday, and I just can't get over how perfect of a client he is, and I want to share his story with you. He is an avid runner for the most part. He's not necessarily training for marathons, but running is an important piece of his health and wellness routine. He would run 2 to 3 times a week, 5K every time, just to stay healthy. He enjoys the outdoors. He enjoys the cardio part of it. But somewhere along the way, somewhere in the fall of last year, he started to develop knee soreness and knee pain with running to the point where he would go for a run. It would hurt that night, and then it would hurt the next 2 days. And he was at the point where he was like, I don't want to run because my knees are just going to be sore for the next couple days, and then it's going to be time to run again. So he would just find himself in the position where his knees were perpetually sore. So before he had his first appointment with me, he stopped running for a couple weeks, was hoping that the knee pain would subside, and they did get better, but now he was scared to run and he wasn't really sure how to do it. So one of the first things that I did was I looked at his knees and they looked fine. His knees looked okay. Anyone that would have some sort of a massive problem with a ligament in their knee is going to have some signs that show up on the table. They're going to have, instability, weakness, pain with motion, those kinds of things that are more acute. That's going to be someone that's definitely not ready to run. However, he looked fine and he was able to squat and he was able to go up and down the stairs. No big deal, but he just couldn't run. His knees were sore. So I got him on the treadmill. I looked at his run, measured his cadence, and I was like, dude, you're overstriding, you're hitting with your heel, and your cadence is too low. That is like the most common situation that I see in people that are feeling knee pain as they're running. They're overstriding, their cadence is too low, and they're hitting with their heel. And while that heel detail isn't necessarily the devil, it does kind of play into this clinical picture that I see all the time in people that have knee pain with running. So very simple fix for him. Shorten his stride length by increasing step rate while maintaining the same speed. So kept him on the treadmill, running the same speed, and I said, okay, now you're going to run with this metronome and try to match your foot strike to the beat of the metronome. We increased it 10%, and he was like, wow, I can't believe my knees feel this good as I'm running. And I'm just like, this is a day in the office for me. That I love helping people make that transition to where running is something that is a source of pain for them, is a source of stress and anxiety because they're worried about the pain that they're having, and helping fix very simple details about the way that they're running, most notably reducing their stride length by increasing step rate / cadence, and just making running something that they can do again, and just making running something that doesn't hurt, and then they get all the benefits that they previously had with running, the cardiovascular benefit, the mental benefit, and just being able to get out there and enjoy the weather, and to help someone go from a position where they're sore and avoiding running to the point where they're like, oh my God, I can do this again and it feels good with some new focuses and some new technique is really awesome. So that's what I'm doing every day in my clinical practice here at Valiant Physical Therapy in Evanston, where I specialize in working with runners. So if you have a running related problem, schedule a free discovery call with me by going to valiantphysicaltherapy.com and then clicking the link to schedule a call with me. If you like this video, give it a like. If you have any questions, drop it in the comments and I'll answer them. And if you think you know someone that might benefit from seeing this video too, send it over to them. Thanks for watching.